Hi, and welcome. Contract termination is one of the results that comes out of negotiations between a healthcare provider and a health plan. We'd like to take this time to talk about why a provider might terminate their contract rather than renew it. Here to talk more about this topic is Jen Sanders. Good morning, Jen.
Good morning, Elaine. I'm glad to be here.
So why might a provider terminate their contract with a health plan?
Well, with every contract renewal comes a rate increase. Sometimes the proposed rate increase is just too high. If a provider and a health plan cannot come to an agreed rate, one of them may send the other a termination notice. Unfortunately, these negotiations are often disruptive and cause a lot of frustration and confusion for our members.
How do contract negotiations normally work?
Providers contract with health plans for a set length of time, and when they're up for renewal, they meet so they can work together to come to an agreement on rate increases.
Rate increases seem like something that comes with every contract renewal. What specifically causes providers to request higher reimbursement rates?
There are many factors that contribute to the costs of healthcare, including inflation, labor, and material costs. As many know, rising costs are being felt across all industries nationwide. As costs rise, we see more health systems ask for unsustainable rate increases. But health plans can't always rationalize such dramatic jumps. These economic changes are bigger, systemic issues, and health plans cannot solve them alone.
How do these big rate increases affect members?
Higher rate increases lead to higher member costs. Since affordability is often a priority for customers, and they're already paying quite a bit already, eventually a health plan may need to step away from negotiations to prevent higher member costs.
Has this ever happened at Premera? Have contract negotiations with provider groups failed in the past?
The last time that Premera had a large provider termination was in 2008, but ultimately that provider returned to our network 3 years later.
So provider terminations don't happen often then?
No, fortunately they're not a regular occurrence. Occasionally it happens with smaller provider groups, but it rarely happens with larger ones.
As situations like this come up in the industry, what is Premera's priority?
When members seek health care, the last thing they should be worried about is uncertainty and confusion over their coverage. As one of the oldest and largest health plans in Washington with deep community roots, we take our job seriously and are determined to provide you with access to the best quality health care at the best price. We are always negotiating contracts with our members' best interests in mind.
Well, that's all the time we have. A big thank you to Jen Sanders for taking time out of her busy day to chat with us. Please watch our other videos on this topic to further understand the complexities around provider terminations. If you have any specific questions that we were not able to answer, please call us at the number on the back of your ID card. Thank you for watching.